Hello, everyone. I'm so excited for you to be tuning in today as we talk about Mental Health 101. Just a little bit about me. My name is Becca. I use she and her pronouns. I am a doctoral intern at the Georgia State University Counseling Center, and it is my joy to work with individuals and couples and all of our GSU students on mental health. I also engage in outreach opportunities just like the one that you're watching today, just to educate our community about what is mental health, what are resources that are available. So, as we get started, if we were in person, I would ask you to do this. So, I will just be giving a little bit of a pause. But as we get started, I want you to take out a piece of paper, maybe the Notes app of your phone, and just reflect on this question. What comes to your mind when you hear the term mental health? Are they positive words? Are they negative words, images, pictures? Just really what comes to your mind? And just take a few moments just to kind of reflect on this for a second. So, what do we know? We know that the media really shapes our perception of ourselves and of the world, right? And so we also know that, wow, when we look at the media perception and presentation of mental health disorders and mental health experiences, they're really across the board pretty negative. Some of the characters here are very violent. They're very manipulative. Just can be really negatively portrayed in the media, and that has a really big impact on our perception of mental health and our perception of who does and does not need and get access to care. So this picture is a little bit of a primer, I would say. But I'm guessing that maybe when you thought about in that initial question there, what comes to mind for you when you think about mental health? You probably thought about a white guy sitting with a suit on and a clipboard, asking questions, nodding, writing notes, that sort of thing, while maybe someone lies on a couch. Usually the patient or client probably woman identified, femme identified. That's usually kind of what comes to mind because that's the way that the practice of psychology and counseling has really been for a very long time. And so part of this presentation is I want to encourage us to break these stereotypes and break these myths. Really and truly, therapy is for everyone and it should be accessible for everyone. Also, something important to note is that you don't have to be crazy. Nothing has to be quote unquote wrong with you in order to access care. In fact, I think that, and personally, I think that it's a really good thing when people seek out care before something in their life comes to the surface where they're like, man, I really wish I had sought out someone to talk to you about what I'm experiencing and got some help before it reached this really intense point. Folks can come in for therapy for anything, a wide variety of things, from feeling some homesickness, being in a new environment, coming to college for the first time, all the way to traumatic experiences and post-traumatic stress and anxiety and depression and friendship loss and just all of the things that we as humans go through. They're all valid reasons to come to counseling. So I just want to highlight again, part of the reason for this presentation is something I'm very passionate about is really this message that therapy truly is for everyone. There are so many amazing psychologists and therapists and counselors out there today who are really working hard in their practices to break these stereotypes. So I want to draw your attention to some of them. Dr. Joy Bradford of Therapy for Black Girls here in Atlanta, a graduate of one of the colleges here in Georgia. Dr. Dylan Mosley of Radical Health and Healing for queer and trans people of color, and the Asian American Psychological Association for Mental Health and Research. And then Therapy for Black Men is also an organization. So just some examples of organizations and individuals that are really working to bust that stereotype that therapy is for white, cis, straight people. really therapy is for everyone and has evolved over the decades to be more accessible, amenable, and really congruent for a diverse amount of people with different identities and backgrounds. So let's talk about mental health. Let's talk about some of the experiences that college students on our campuses are experiencing. So what's on the screen here is just some information from the national statistics from a really big survey of university counseling centers that happens annually. So of the 50,000 plus undergrad and grad professional student respondents in the spring of 2020, take a look at these numbers. 22% reported ever having been diagnosed with depression, finding it difficult to function. That is one of the number one, or is the number one reason for us here in the counseling center to see students. 27% reported ever being diagnosed with chronic anxiety. 17% with both depression and anxiety. That is very common. 61% feeling some level of hopelessness. 2.6% has seriously attempted or seriously considered attempting suicide, and 2% had attempted suicide in the last 12 months. 80% feeling overwhelmed by responsibilities. 50% rating their mental health as below average or poor, and 80% feeling exhausted. So I hope that these statistics of fellow college students across the nation will help you know if you are experiencing any of these symptoms or experiences that are listed here, that you're not alone, and in fact it's pretty common. So let's look at Georgia State. What's happening here on our campus? 94% of folks coming into the counseling center are experiencing stress, anxiety, depression. 66% interpersonal difficulties. 31% bereavement, grief related to the loss of a loved one. 33% concerns about body image, eating, food. 27% questions or confusion, or I would say exploration around identity, self-image, sexuality, gender identity. 68% difficulty managing or expressing emotions. So let's look at some of the many factors that we know from the research and from the profession of psychology that can impact someone's mental health. There are biological, psychological, and social factors. Really, a myriad of things kind of come together in order to create our experiences of mental health. I kind of think of these factors as light switches. If a certain number or pattern of light switches get flicked on in our lives, if we have a genetic predisposition for anxiety, for example, if we have a lot of life stressors, financial stress, racial ethnic discrimination going on, friendship issues going on, if we have social issues like family distress, then that's going to be the pattern of the light switches that is going to contribute to anxiety happening. One thing that is really important and that we really honestly don't talk about enough is the impact of the social impact of different experiences of oppression on mental health. It is really important to note that racial trauma is real, heterosexism is real, cissexism is real, and they have very lasting effects on our mental health, especially when we consider intersectionality, which just means we're looking at the impact of multiple intersecting systems of oppression that show up in someone's life. Yes, these are very difficult barriers to health and well-being, but there are things that we work on in these therapy rooms every day with our students. Just to highlight some of the different facets of identity that are tied to systems of oppression and privilege that can impact mental health: religious affiliation, ethnicity, socioeconomic status, age, ability status, sexual or romantic orientation, gender identity, race, and nationality. There are some common categories within which we as professionals think about mental health disorders residing within. These include mood disorders, anxiety, eating, substance use, psychotic disorders, and trauma. So, what is a mood disorder? Well, if you have a mood disorder like major depressive disorder, for example, or seasonal affective disorder, your general emotional state or mood is typically sad or irritable and just interacts and just really gets in the way of your ability to function. So let's take a look at some more statistics. And my hope in presenting these statistics is that you will see if you are one of the many of us who experience mental health symptoms, you're not alone. So 13% of college men, 25% of college women were clinically diagnosed with chronic depression. The survey indicated also around 40% of college students experience at least one major depressive episode. And as many as 1 in 5 patients with bipolar disorder, which is a type of mood disorder, complete suicide. What are some symptoms of some common mood disorders? Look out for things like feeling sad, a lot more than usual, not usually tied to grief responses, crying at the little things, feeling a loss of motivation, feeling not interested in doing things that you used to love or enjoy doing, feeling irritable or bored, isolating yourself from friends, like not responding to text messages, not going out with people, feeling worthless, feeling hopeless, a constant state of sadness, sleeping and eating either more or less than usual, just having shifts and changes, having thoughts of suicide or creating a plan, extreme shifts in mood, having highs and lows, and maybe some increased impulsivity. One important thing that I want to make sure that we have time to talk about today is suicide. Untreated depression is the #1 cause of student suicide. Suicide is the second leading cause of death among people between the ages of 10 to 34. 1 in 10 college students has made a plan for suicide, right? This is a very serious topic. If you are having thoughts of suicide, please seek immediate attention at the counseling center. You can access us 24/7. If you're in crisis, I want you to write this phone number down, put it in your phone. I'll give you a second to grab your phone or grab your paper. Our number is 404-413-1640. If you're calling us after hours, after 5:15, you'll have to follow the voicemail prompt to speak with a counselor. And as always, if you are in imminent danger or threat to yourself, please call 911 or proceed to your nearest hospital. I also want you to know about the National Suicide Prevention Hotline. Again, it's available 24/7. Give you a second to ready your pencil and paper, grab your phone, put this in. You might need it for yourself, you might need it for a friend one day. That number is 1-800-273-8255. So one thing you may be asking yourself as we've been talking today is, hey, I looked at that list of symptoms, or I heard you talking about those, and well, gosh, how do I know if this is a potential problem? So these examples may be helpful. So maybe some more typical things, still things that we can talk about in therapy and still are relevant for therapy, but maybe more typical. Occasional worry about situational events, feeling self-conscious or uncomfortable in social situations, feeling more nervous about like an important event coming up, a test, an event. And really realistic fear about a threatening situation. Maybe more typical, and also we can work with you on these things in therapy. More problematic, more shifting towards something a little bit deeper might be going on here. Constant, chronic, unsubstantiated worry that is really disrupting your functioning. Avoiding social situations because you're afraid of judgment or humiliation. Repeated panic attacks, heck, even having a panic attack. Repeated intrusive thoughts, or performing uncontrollable repetitive actions. These are things that we would really encourage you to call the counseling center and to access services. One of the key things that we look for when we talk about mental health is really evaluating the level of impairment because of the symptoms in different domains in that person's life. So as you can see here on the screen with the arrows, schoolwork, relationships, activities of daily living. This can be things like personal care and hygiene, making sure that you are taking a shower, brushing your teeth, that sort of feeding yourself. Home or family disruption and disruption in relationships. If someone's symptoms are impairing them in any of these life domains or in multiple life domains, that's when we're really going to be tipping towards, we might be looking at a disorder here. I want to go ahead and give a little bit of a trigger warning for some of the next couple of slides. We're going to be talking about things like eating disorders, sexual assault, just different experiences that people might have. And some of you watching this statistically will have experienced one or more of these things. So trigger warning, take care of yourself, excuse yourself if you need to, do what you need to do to take care of yourself, okay? But let's talk about eating disorders for a second. It's a very common type of mental health disorder that we see on college campuses. Take a look at these stats. Between 10 to 20% of college women are struggling with an eating disorder. Between 4 to 10% of college men also struggle with an eating disorder. It's really important to understand it's not about gender. 35% of normal dieters develop unhealthy eating behaviors. One study found that 35% of women and 10% of men college athletes were at risk for anorexia, and 58% of women, 38% of men were at risk for bulimia. Eating disorders have the second highest mortality rate of all the mental health disorders, surpassed only by opioid addiction. And as I was saying earlier, it's important to know it's not about gender. This is not a quote women or femme issue. Trans and non-binary people are at a higher risk of developing eating disorders than cis men and women. Another very common mental health disorder or issue that we see in the college community is substance abuse and misuse. Alcohol, illegal substances, caffeine can really mess with your sleep, your digestion, a lot of different issues that then impact your mental health. Your physical health and your mental health are interrelated. And then abusing prescription medications is also something very common that we see. Let's look a little bit at statistics so you can see that I really like stats. And again, the reason that I'm sharing these stats with you is because I want you to see that if you are one of us who experiences any of these issues, you're not alone. Almost 50% of young people with severe mental illness also abuse drugs and alcohol. It's very common. And mostly when in services, the reason folks do this is because you're trying to cope with the painful emotions that you're experiencing. And so something we can do in therapy is to help you, again, learn those skills, how to adaptively or more healthfully cope with the emotions that you're experiencing. About 1,700 students die every year from alcohol-related injuries. 40% reported at least one symptom of alcohol abuse or dependence, and 1 in 4 students have reported academic consequences as a result of their drinking. So, graph, right? But the big takeaway is that substance use is actually higher in people who have mental health disorders than in those who do not. And again, thinking about the reason for that, a lot of people are using substances to numb, to cope. And that is okay, it's understandable, and also is changeable. You don't have to hurt yourself in order to try to feel better. There are so many skills and things that we can teach you and help you learn and integrate into your life to cope in better ways. So before I go to the next slide, just a heads up, I'm about to talk about sexual assault. And because of some of the stats that we're going to go through, I know that some of you who are watching this video have probably experienced sexual assault of some sort. So again, pause this video, step out if you need to, take a break, take care of yourself. We know that sexual assault is highly prevalent across college campuses across our country. Some statistics, around 19% of women will be sexually assaulted during their time in college. 84% of women survivors have reported being sexually assaulted during the first 4 semesters. Alcohol is involved in 75% of these attacks. It's important to note it is never your fault. It is never the survivor's fault, no matter the circumstances. Even if alcohol was involved, it's still not your fault. Date and acquaintance rape is much more common than stranger rape. Around 90% of campus sexual assaults are committed by people that the survivor knows. 34% of student survivors of sexual assault experience PTSD. And all of these things are things that we can talk about and treat in the University Counseling Center. Again, if there is not enthusiastic, verbal, or written consent, it is rape. If it is against someone's will, it's against the law. Now let's talk a little bit about some more disorders that do tend to crop up around the time that young folks are in college. Psychotic disorders are a category of mental health disorders that just to be aware of for yourself or maybe some friends, maybe you know some family. It does pop up around the ages of 16 to 25, which is why it's important to know. It is a chronic, severe, and can be disabling brain disorder that affects around 1% of Americans. In the spring 2020 survey, around 0.3% of college students did report schizophrenia or other psychotic conditions. Less than 50% of these same individuals reported going to a mental health professional for support. Let's just stop right there and think about that. Folks who are experiencing impaired reality testing, hallucinations, delusions, disturbances in cognitive and emotional functioning, less than 50% went to a mental health professional. I think some of that for me goes back to the stereotypes, the stigma, the barriers that we talked about in the beginning of this presentation, but also I don't think there's enough awareness about what these symptoms are and how they impact people's lives. So let's talk a little bit more about some reasons that folks don't go to counseling. I love this quote from the Surgeon General's report. More often, culture bears upon whether people even seek help in the first place, what types of help they seek, what coping styles and social supports they have, and how much stigma they attach to mental health. So if we were in person, I would pause this here and say, well, what is the culture at Georgia State around seeking help? And if you felt like you needed it, do you feel like you would be interested or able to do so? Do you know where to seek out services? Do you know how to access help? There are other culture-bound reasons for not seeking therapy services, such as religious or spiritual reasons, and the idea that we shouldn't put down or shame family members or air out our dirty laundry in public. These are all valid reasons, they are culture-bound reasons, and they are things that we can work with in the counseling room together. So, while it's true that taking that first step to access to help is so hard, it can be so difficult, it is also true that being in counseling can be so rewarding and life-altering in a really positive way. Here in the Counseling Center, there are a number of reasons why that folks come in for. Some common concerns that we address in treatment here: stress, anxiety, homesickness, body image, trauma, cultural diversity considerations, sexual orientation and gender identity exploration, grief and loss, academic difficulties, substance use, sleep disturbance. I mean, the list can go on and on. And the important thing to know here also is that some of these common concerns intersect with one another or impact one another. And it's very common for folks to come in with multiple of these common concerns, and we can work on that. So, what does therapy look like? Let's talk about that. The truth is there is no one-size-fits-all approach to therapy or treatment for anyone. Talk therapy can be helpful. That's what you would get here at our counseling center. But people can also find immense support in group therapy. We also offer that here at the counseling center. Music therapy, engaging with their own community for social support, and engaging in religious or spiritual or cultural bound avenues for healing. All right, so we've spent a lot of time talking about the negative aspects of mental health and the negative things that are often accompanied by mental health. But what about the positive aspects of mental health? Well, we know from the research there are some protective factors that can help people and put people more at an advantage when it comes to having positive wellness and mental health. Some of these include creating and sustaining a well-developed sense of identity. Do you know who you are? Do you know what's enough? Having a positive sense of self-esteem and internal sense of competence. Creating and sustaining and having a healthy support system and feeling connected to your community. Having supportive relationships. Maybe that's biological family, maybe it's not. Maybe it's chosen family. The presence of healthy cultural or religious or spiritual structures for people who have religious or spiritual backgrounds or identities. Not everyone does. The ability to maintain a grounded perspective, engaging in self-care, and having distress tolerance skills, which are all things we can talk about in therapy. Actually, all of these things we can help you grow and learn in therapy. So based on some of the statistics that we were looking at earlier, it is probably likely that you know someone who is experiencing negative mental health symptoms. One of the best things you can do to help that person is to get them to a professional person, such as a counselor. However, in addition to getting them access to professional help, some common things that can be helpful is listen, show concern, try not to avoid them or avoid judging them. Educate yourself, just like you're doing today in this presentation about what mental health is and what is helpful. Don't make decisions for your friend. Try to partner with them and help them access resources. Be available to your friend, but don't become their only lifeline. Hold healthy boundaries. And if you struggle with that, that's something you can talk to your therapist about too. Help your friend find help. And don't forget to take care of yourself. So I do just want to take a few moments just to tell you all about the counseling services that you have available to you as a Georgia State student. We do have, as you can see on screen, urgent care and crisis support 24/7. You can always get in contact with a licensed counselor by calling the front office by 404-413-1640. I would urge you to go ahead and take your phone out, go ahead and program that in so you always have access to it. We also have same-day consultations that you can ask to speak with a counselor same day, and we can usually get you in the same day. Those are usually very focused sessions to help you with a certain problem that you're experiencing in that moment, like a breakup or stress management. We do also offer individual and couples counseling. We offer sessions, usually 8 sessions bi-weekly. We also offer client advocacy with Dr. Webb, so helping you get access to connecting with community resources for things like housing and food and healthcare. We also have a variety of group counseling services available for coping skills, emotional resiliency, LGBTQ support group, the African American Women support group, grad student support groups, and a variety of others. So feel free to ask and we can tell you a little bit more. We also have psychiatry services available for medication for those students who are enrolled in counseling services at Georgia State's Counseling Center. We also have a plethora of wellness programming through the Be Well Panthers. You can check us out on Instagram at Be Well Panthers, as well as on YouTube, as well as bewell.gsu.edu for an online magazine. And right now, we do not have access to our Stress Less tech at the time of this recording in January of 2022, and that is because of the COVID-19 pandemic, but hopefully we'll be able to return to those services soon. One thing that I do want to briefly mention is that all services rendered at the Counseling Center are confidential. What that means is that anything that you share with any of the Counseling Center staff cannot be shared with anyone else. There are limits to confidentiality, and they include if you let us know that you're a current and imminent threat to harming yourself or others, if you let us know about an abuse situation that's happening to someone who is an elderly person, a minor, or a person with developmental disabilities, and if you, for whatever reason, get involved in a legal altercation and we get a signed court order subpoena. However, these are very rare occurrences, and we do take every effort to keep all of your information and everything you share with us completely confidential. Next thing I want to talk to you about is a free service that Georgia State University is providing to all of our students called TogetherAll. TogetherAll is a great place to find peer-to-peer anonymous support. You can post and receive support for a variety of topics and life stressors, and you can also support others, which usually helps you feel better too. There are also a few mini courses that are available on topics like stress management, time management, and other things that can be really helpful for you. This website is always monitored by a counselor just to make sure that we can keep the environment safe. And you can either scan the QR code that you see there or go to TogetherAll online and just sign up with your student.gsu.edu account to get started.
Want to build your resilience? Panthers Strong is a new app available to students. It's like a resilience coach right in your pocket. You can learn to manage financial, professional, and personal stress, reduce anxiety and depression, build your resilience and resolve, achieve mindfulness and mental well-being. Download the Driven Resilience app on your mobile device. It's free in the Apple and Android app stores. Use your GSU email to create an account, and the access code is PORAJE. We also offer free MindWise behavioral health screens. Follow #MindWiseGSU to take a free screening.